New South Wales has recorded 15 new coronavirus cases, half the amount confirmed on Sunday, despite record testing. Our reporters are standing by in New South Wales and Canberra to bring you the very latest. We'll go to Charlotte Mortlock first. Good afternoon to you, Charlotte. Look, it is good news, but do we know what Christmas will look like?
Not quite yet, Julie. Of course, we know that in New South Wales we have seen some positive results in the past few hours, just 15 new cases, which, as you say, is half what we saw yesterday. But the Premier, Gladys Berejiklian, says that it is simply too late to say whether or not this will be the start of a downward trend, but that is the hope. Some other good news we had more than 38,000 tests conducted across the state yesterday. Now, that is the largest we've ever seen, a new record for the state. As for Christmas Day and those plans, of course, thousands of Australians have had their festivities and holiday plans thrown into disarray because of this. The Premier says on Wednesday morning they will make a decision on exactly what Christmas Day will look like.
This is an ongoing and evolving situation, and we know how contagious the virus is. There could be very well developments in the next few hours which cause us again to go back to the number of cases we've seen in the last few days. So I appreciate how frustrating it is, and I'd love to be able to tell everybody today what Christmas might look like in New South Wales or the Northern Beaches, but we're not in a position to do that yet.
250,000 Australians are still in lockdown in the northern beaches of Sydney. Now, they're set to come out of that lockdown at midnight on Wednesday, but there is no word yet whether or not that could be extended. The government haven't indicated that at this point, but they'll make a decision on that as well on Wednesday morning. There are a few new areas that are a concern because they have been venues where spreading has occurred. That is the hair salon in Turramurra, also the Rose Pub in Erskineville, and also an office here in Sydney CBD. For a full list of all of the venues that have been affected by this latest outbreak, you can go to the New South Wales Health website. The government is still asking everyone in the community to wear face masks, particularly if they're at indoor venues or using public transport. The government and certainly the Chief Health Officer, Dr. Kerry Chant, was asked this morning if it's so important for the community to be wearing these face masks, why isn't it mandated?
The feedback I've had from the Northern Beaches community is that everyone is being very compliant with the requirements around wearing masks indoors. Of course, I would continue to stress that, and we will look at any additional requirements around that. Our messaging around masks has been pretty consistent, and I've also noticed we will be monitoring the uptake.
One of the most important lines of defence we have here in New South Wales is our QR code system. The New South Wales government was very quick to act on this earlier in the year, making it compulsory for venues to have those QR codes. But each venue was allowed a bit of freedom as to which app or which platform they actually had that in. Now, one of the issues that we have seen here in the past few days is that a lot of these venues aren't actually getting the correct information from patrons that are visiting those venues. Some people are using fake information, and others is not actually eligible for them to be used in that. They're not writing down their information clearly enough. So it was put to the government and the Health Minister, Brad Hazzard, this morning as to why the government wasn't making it compulsory for all of those venues to have the state-regulated Service New South Wales app.
We have world-class tracers in health, but they can only do their job if we as a community give them the information they need if and when it is needed.
Why is it not necessary now? If you're saying that the information isn't there and you need to contact tracers to do their job, why haven't we already made this mandatory?
Because there are many people who have actually set up structures that work very well, and we're going to work with our community, not actually be punitive as you're suggesting.
Julie, the search continues for patient zero in this particular outbreak, but authorities have located a very close match that they do believe is linked to this cluster. Now, this person flew back from the United States, a return traveller that went straight into hotel quarantine. And now the health authorities are going through who that person came into contact with and if they travelled to the Northern Beaches. It could be aircrew on that lady's flight, or it could be people that transported her to the hotel, or potentially even the hotel quarantine staff that were working as security or cleaners.
Promising.
We actually have, to your point, gone back and reviewed all the CCTV footage around this individual. We're also looking at flight crew, anyone else who may have returned from overseas, and as you know, we do that day 2 and day 12 testing.
In the last week, there have been more than 80 coronavirus cases in New South Wales. Now, none of them at this stage are sick enough to be in hospital. Certainly none of them are in ICU or in ventilators. But the second week of coronavirus is often far more harmful to people. So it'll be very interesting to see what happens with those particular cases. The Deputy Premier, John Barilaro, came out this morning at this press conference saying that if you are feeling unwell and may have symptoms, please make sure you are not travelling to regional parts of the state.
Charlotte Mortlock, thank you very much.